This is CGTN, China Global Television Network.
World coronavirus cases rise above 600,000 as the U.S. shoots past the 100,000 mark. Lockdowns and curfews in African countries to curtail spread of COVID-19. And the fate of the homeless in Europe as isolations and lockdowns continue. Hello and welcome to Africa Live. As always, great to have you with us. I'm Richard Nta, live from Nairobi. And for those of you joining us from across the continent and around the globe, we thank you for watching. Let's take a look at other stories making headlines this hour. The Democratic Republic of Congo rethinks lockdown after price hikes in Kinshasa. And in sports, we look at how athletes are maintaining their strict training regimens under lockdown. Once again, welcome to Africa Live. We start with the coronavirus pandemic. More than 600,000 people have been infected in over 200 countries and regions. The United States has the highest number of infections, which has risen by nearly 19,000 to more than 100,000. Italy recorded the largest single death toll on Friday, with 919 people losing their lives. Its total death toll has surpassed 9,000, which is the highest globally. Spain is the second hardest hit in Europe. Its death toll also hit a record on Friday, with the total at over 5,000. Iran has reported more than 32,000 cases and over 2,300 deaths. The Chinese mainland reported 54 new cases on Friday, which were all arrivals from abroad. In Hubei province, where the outbreak began, active cases have dropped to 2,500 and over 90% of the patients have recovered. In Africa, the rising number of COVID-19 cases is raising concerns. There are now nearly 4,000 cases in 46 countries. Several governments have announced lockdowns and other tough measures to curb the spread of the virus. Well, Uganda has announced 5 new coronavirus cases late last night, bringing the total number to 23. The country is instituting drastic measures that include a ban on public transportation to curb the spread of COVID-19. Let's get the details from Leon Siyenga, joining us live now from Kampala. Leon, thank you for joining us here on Africa Live. Leon, do give us an update on the coronavirus cases in Uganda and what the health ministry is saying about the condition of the patients.
Well, like you said, just late Friday evening, the Ministry of Health here confirmed that 5 new cases had tested for COVID-19. These, of course, were samples taken from over 200 people who were tested. To be exact, 227 had been tested. Samples had been tested on Friday. 222 turned out to be negative. It's only these 5 that have been confirmed as particular positive cases to COVID-19. However, the ministry has not provided any further details on the particulars of the confirmed cases. Those we can only wait for. They, however, confirmed that there's some progress being made from the earlier cases. Just to remind you, Uganda has a total of about 23 cases so far, and those the earlier cases have been rendered in stable condition. Those are being put aside at the Entebbe hospital that is out of the capital Kampala, and others within the main hospital Mulago. So yes, the ministry is sounding confident there with the progress being made with the cases so far, but still concerned with the possibility of rising cases of the pandemic now.
Well, Leon, residents of main towns in Uganda have been hit hard by the government's measures to control the spread of the disease. How are people coping with these measures?
Well, it's certainly a difficult time for several Ugandans who are not quite used to being out of town, being at home. But like it had been stated by the president, the measures here, President Yoweri Museveni suspended public transport. That, of course, meant that only 3 individuals would move in a private car. The army was out on the roads trying to put some sanity into the kind of situation that we have now. Businesses have been closed downtown. Only those selling food are allowed to operate. So suddenly it's a bit of a difficult time, but of course you can't quite throw caution to the wind just yet in a situation like this. People are trying to hang in there, stocking up on food, trying to stock up on anything that they can, medicines, food, the necessities that will be required over the next so many days. The difficult bit again to it is that some people actually have to walk to work several kilometers. Those that sell in the markets probably don't even own a car or even a bicycle, as earlier advised. So yes, the challenge there is the ability for them to walk to and from work, but even still trying to keep themselves safe from the situation now. And I must say, it is quite difficult, but there's no two ways out of it.
Leon Siyenga, excellent reporting. Thanks for talking to us live from Kampala. Moving on, in Ghana, President Nana Akufo-Addo has announced unprecedented new restrictions to life in an address to the nation on Friday to curtail the spread of the coronavirus. People have been asked to stay at home and away from others. The measures are expected to come into force on Monday. Let's get more from Nabil Ahmed Rofai joining us live from Accra. Nabil, thank you for joining us here on Africa Live. Tell us more about the president's address.
Richard, basically last night the president's address sought to assure Ghanaians that the government is doing all it can to contain the spread of COVID-19. So this latest update is the fact that 3 regions out of 16 are going to be on lockdown effective Monday. What it means is that these intercity buses that move from these 3 regions to other parts of the country will now be on total shutdown. They will not be allowed to load people and also move from Accra or let's say Kumasi or the part of the central region, Kaswa, to the northern part of the country. All these intercity buses are going to be on a halt in terms of operation. Aside that, the president says the lockdown is actually not going to affect some parts of the ruling of the government in terms of the legislature, the judiciary, and also the executive. These 3, part of the government would have to still be at work and continue the business for the government. But then with this particular lockdown going to take effect, people were allowed to go about limited movement in terms of going about to get some essential services. What this means is that if you'd want to go to the pharmacy to get some medical supplies, you'll be allowed to do so. If you also want to go to the market to purchase some food stuff, you'll be allowed to do so. But then, whilst going about these essential activities, you are advised to observe some social distancing so as not to spread the COVID-19. Also, in terms of transportation within these 3 cities that are going to be on lockdown, the local bus operators have been advised to limit the number of people that they take in their buses. So, for instance, a bus can take up to 16 passengers, but that's not going to be that's not going to happen within this lockdown period. About half of the passengers will be allowed to be in the buses, all in a bid to protect citizens and also observe the WHO's self-distancing measure. So these are some of the things that the government said last night, the president said last night. Also, one key thing, the government bears in mind that this lockdown is going to take 2 weeks. What it means is that economic activities are going to really suffer, and the president says he's allocating $170 million as a stimulus package for businesses and some households that will really feel the impact of this 2 weeks lockdown. And then he also said, as and when the situation, he gets updates on the situation, then we'll see either a review of this 2 weeks period of lockdown that these 3 regions are going to feel within this period. Richard.
All right. Now, Ghana has reported at least 137 confirmed cases of coronavirus. How is the health system coping with this situation?
So mainly this 137 cases of COVID-19 that Ghana has, the president says 97% of these cases are actually imported. So the health officials are actually trying as hard as they can to do contact tracing because there were some cases that were recorded as a result of a community spread. So the health officials are saying with this 137 cases that we have, 4 have died and 2 have fully recovered, meaning some of those who have this COVID-19 are undergoing treatments and they are responding to treatment. We also know that on last week Sunday, about 1,030 people came into the country and all of them have been quarantined and are undergoing treatment. With this PPEs donated by Jack Ma, we know that is going to speedily help in the testing of these people that came to the country last Sunday, over 1,000 of them, and the health officials are saying they are self-isolating some of those cases that have the COVID-19 and going through the necessary treatment to see how best they can recover. Richard.
All right, let's leave it there for now. Thank you so much, Nabil Ahmed Rofai, talking to us live from Accra. Moving on, South Africa's President Cyril Ramaphosa has held a teleconference with the members of the African Union Bureau, this in an effort to coordinate the continent's approach to the coronavirus pandemic as a result of the growing number of people infected in Africa. As chair of the AU, Ramaphosa wants leaders to talk about ways to contain the spread of the virus and mitigating its impact on the people and economies of Africa. CGTN's Yulisa Njamela has more.
I'm delighted we can meet like this.
The African Union organs, partners and philanthropists are key players to the AU. Their role formed part of the discussions here, with the objective of optimizing on their resources as part of a wider campaign to mobilize resources, especially for poor countries with infrastructural challenges.
This is unprecedented times, and I think it's important that as the AU, we should be able to have a response to the crisis that the world is facing.
The teleconference meeting also looked at collaboration with the United Nations Secretary in his efforts to address the pandemic globally. President Cyril Ramaphosa later also participated in a G20 leaders virtual meeting from Pretoria and wanted to carry the message of the African continent's leaders to that meeting.
When I speak there, I would like to know that I'm raising issues that have the backing of the continent. So that's why I thought it was important that we should have this teleconference meeting so that we can work out the position.
Most African countries have implemented some measures to try to combat the virus. These include imposing curfew and travel bans. South Africa has gazetted a new set of rules with stringent measures to ensure that there's a curb to the spread of the coronavirus. President Cyril Ramaphosa envisages that all other African countries who are also affected will likely do the same. Yolisa Njamela for CGTN in Pretoria, South Africa.
Zimbabwe is facing challenges in implementing some of its measures to control the spread of the coronavirus. Long-standing economic challenges have informalized the economy and left critical infrastructure in disrepair. CGTN's Farai Mwakatuya has more.
Borders have been closed for human traffic, public gatherings of more than 50 are prohibited, and schools, universities and bars have been shut down. But an all-out lockdown, which many believe would be hard to enforce, has been avoided for now.
Most of us are vendors, so if you're forced to stay at home, we will die of hunger. A lockdown won't work.
Even if the defiance was overcome and people stayed home, they would still lack a basic essential: water. Some residents in the capital have not had running water for years, and what they do get from community boreholes may not be adequate to keep the coronavirus at bay.
We used to be scared of cholera, but now there's coronavirus, which finds us in the same predicament. Not enough water to wash our hands frequently, and the water from this borehole is rusty and can affect our internal organs if we drink it.
Even those meant to be at the front line of fighting the outbreak are fearful due to a lack of protective equipment. Junior doctors have withdrawn their services until their safety is assured.
As we speak, Harare Central Hospital is closed. It's locked because all the nurses decided to go and stay safe at home because there was no plan. There was no plan as to where they are going to get face masks, etc.
But the country's main referral hospital, where safety and screening has been enhanced, remains functional. The Health Ministry says donations, including a consignment of equipment from Chinese philanthropist Jack Ma, are being urgently distributed across the country.
As soon as those personal protective equipment becomes available at the hospitals, and as soon as our safety as healthcare workers is guaranteed, we are ready to serve the Zimbabwean population.
The Zimbabwean government has begun inviting private players to refurbish idle hospitals to expand the country's capacity to deal with more infections. Farai Mwakutuya, CGTN, Harare.
And Tunisia has put in place a general lockdown as well as a curfew until April the 4th. CGTN's Adnan Shawashi has more from the capital, Tunis.
Tunisian health authorities have warned that the country will suffer human losses if the general lockdown and quarantine measures are not fully respected. The head of state deployed the army in response to the failure to comply with these decisions, especially in regions that have recorded horizontal transmissions.
I understand the measures are necessary for health reasons, but I can't stay at home for the whole day. It's difficult to change one's habits.
Staying at home and respecting the lockdown and curfew is not out of fear, but rather a responsible behavior to stop the spread of the virus. I agree that our rights may be restricted for a short period of time to save lives.
The Ministry of Health noted that China's management of the coronavirus crisis is exemplary.
The epidemiological situation can improve if we follow China's strategy, where the number of infections and deaths is down and will certainly reach zero. China's example is reassuring.
The president of the Health Commission at the Tunisian parliament also noted that many lessons could be learned from China's successful lockdown in some affected regions.
Chinese authorities closed a dozen makeshift hospitals in Wuhan. This proves that efforts to curb the virus are working when people respect the lockdown. This is a lesson for Tunisia and Africa, where governments do not have enough means to face the virus. China's success is also a lesson to the world.
The Ministry of Health has urged citizens to respect coronavirus general lockdown. Authorities say this behavior is not a procedure that limits freedom, but rather a necessary measure to protect public health. The director of the National Observatory of New and Emerging Diseases declared that it is still possible to redress the situation by respecting the general lockdown, the curfew, as well as all prevention measures. The official added that otherwise the consequences will be disastrous. Adnan Shawashi, CGTN, Tunis.
Governments across Europe are ordering their citizens to stay indoors as the coronavirus pandemic sweeps across the continent. But for thousands of homeless people, that's just not an option. To help protect these vulnerable individuals, shelters and NGOs are opening up isolation centers and ramping up screening. CGTN's Tony Waterman has more from Brussels.
A few years ago, Elvira Aliaj fled Albania and an abusive husband.
I don't have contact from my family, and I'm left Albania, and I'm left everything, and I come here.
The 32-year-old mother of two has bounced around ever since. Antwerp first, now Brussels. She was working at a local bar, but she stopped taking her medications, and the job disappeared. For the last 9 months, she's been living here at the SAMU Social homeless shelter.
It's big person and good person. I love she is very good.
Elvira is one of the 4,000 people sleeping rough in the greater Brussels region. In the best of times, the homeless are among society's most vulnerable. During the coronavirus crisis, their problems have multiplied.
Now, of course, with COVID, it's of course we do have to refuse some people. Homeless people are known to have several medical problems. We call it comorbidities, and of course we have to care especially for them.
People with underlying health problems are especially susceptible to the deadly effects of the disease. One homeless person staying at SAMU Social has already tested positive. Another is awaiting results. To manage contagion, the group recently opened an isolation center for suspected cases. Of the 19 beds available, 9 are already taken.
We also call with other organizations like Doctors of the World and the street nurses for more widely screening of people, so we really know who is infected or not.
The Belgian Red Cross is also ramping up services, opening isolation zones for up to 15 people.
If someone were to have a health problem in this centre, we would put them in this room. It's not for 4 people, but 1 or 2 maximum, while waiting to be transferred to a referred hospital.
Hospitals in Belgium are required to provide treatment to everyone, regardless of whether they have health insurance. Back at SAMU Social, Elvira says she's taking all precautions to ensure she doesn't get sick.
And I'm not protect, just I'm take this. I'm go every day, in morning and in night. For SAMU Social, take shampoo, eat water and food free.
Good hygiene may be the best preventative measure, but for many homeless people, it's a basic necessity in short supply. Tony Waterman, CGTN, Brussels.
Each day, there are millions of stories. Each one can open new perspectives, new possibilities. Wherever you look, we are there to see, discover, explore. We put the pieces together to find what really matters to you, all around the world, all around the clock. Our reporters are at home across the globe. From our headquarters in Beijing and production centers in Washington, Nairobi, and London, China Global Television Network. Stories from across the globe, reaching people across the globe. CGTN. See the difference.
Welcome back to Africa Live on CGTN. The Tunisian parliament has held the last plenary session in the presence of MPs amid tight security and sanitary measures to discuss the national strategy against coronavirus. The parliament has opted to hold online meetings for an undetermined period.
This is the last plenary session at Parliament in Bordeaux City. The Speaker and his 2 Vice Presidents have been separated to ensure their safety and the proper functioning of the parliamentary commissions.
Ladies and gentlemen, we must adapt our working methods to the latest developments and the coronavirus threat. We encourage the Parliament's remote work.
The use of technology has been approved by all parliamentary blocs to prevent the spread of coronavirus. In fact, the 217 MPs come from 217 different cities and towns in the 24 regions across Tunisia.
I usually travel for 200 kilometers to attend the plenary session. This is risky during the general lockdown. Imagine 217 MPs and hundreds of parliament employees in the same building. There's a high risk of contamination. Technology is the solution.
The Parliament's Bureau has already held its first online meeting. MPs discussed the general health situation in the country and the national strategy on coronavirus fight.
This is a good initiative and a technological solution to avoid direct contact. Millions of people can follow the plenary sessions online or live on television.
The House of the People's Representatives has created a crisis cell to closely monitor the online interventions and ensure coordination between parliamentary blocs. The Speaker of the House of the People's Representatives and his two vice presidents, as well as 217 MPs from ruling and opposition parties, have been trained on using technology in order to make the Parliamentary Commission's activity more effective amid the general lockdown and the curfew. Adnan Shawishi, CGTN, Tunis.
Well, Uganda has declared every last Saturday of the month as a national cleaning day. And this is to mobilize the public to improve their sanitation and hygiene during the COVID-19 outbreak. There has been intensified screening of all people entering the country among some of the measures to curb the spread of the disease. At least 46 African countries have reported cases of the coronavirus. According to the Health Ministry in Uganda, 75% of the disease burden is attributed to environmental health and poor sanitation.
The objective of this is just to awaken the conscience of every Ugandan on the importance of a clean and healthy environment. Only 36% of the Ugandans wash hands at critical times, before eating and after eating. So we now have to develop that habit of hand washing, which is at 36, and also we're emphasizing general cleanness, personal hygiene, domestic hygiene, food hygiene. All those add to the sicknesses. And when the coronavirus finds you when you are very weak, then it just sweeps you like a small insect.
Following the winter season, the northern regions of Niger have been invaded by swarms of desert locusts. But the people there have started to catch and sell the insects. We visited a market in Niger to see how this seasonal activity has helped generate income for many informal traders in the country. CGTN's Tuli Shabalala has that story.
The markets in Niger have been inundated with desert locusts since the end of the winter season. There are dozens of sellers of this edible insect all over the country, and it's a booming business. In the capital Niamey, the Katako market is one of the best-known places to buy and sell the locusts.
Luckily, many people consume it. The price of a bag of locusts varies between $80 and $100. But we also sell in retail, and sometimes it's exported to foreign countries.
Generally, I buy locusts in large quantities. I prefer to come to this market because the prices here are affordable compared to other markets. I like the locust, and when I come here, I buy for the whole family and friends. Today, for example, I bought 13 boxes.
Mardia Omaru has been a locust trader for over 10 years. Every day, tens of kilograms of desert locusts are fried and sold from her home, with the use of chili, garlic, salt, and a few other ingredients. As a mother and a widow, the income made from this business helps her to provide for the needs of her whole family.
It would be a lie if I ever said that this business does not pay. I have 4 children and all go to school. Thanks to the sale of locusts that I managed to educate them. I indeed have another activity, but the sale of locusts is my main source of income. By the grace of God, it pays a lot.
Niger's regions of Maradi, Zinda and Tahawa are where most of the locusts are caught. They use nets, their bare hands, or even pesticides. But nutritionists warn against the use of chemicals.
There are many drawbacks to consuming locusts when they are not properly caught. It is very dangerous to use pesticides to catch locusts because pesticides are harmful to human health. They can cause digestive disorders such as diarrhea, vomiting, and even allergic reactions. In the long term, the ingestion of pesticides can cause cancer.
The locust trade is becoming a big informal sector in Niger. In 2013, the Food and Agriculture Organization recommended the consumption of edible insects to enhance food security. According to specialists, the dry weight of a locust consists of about 62% of protein. Thuli Shabalala, CGTN.
We've got your business news coming up next. Here's a look at what's ahead. The Democratic Republic of Congo rethinks lockdown after price hikes in Kinshasa. And African experts weigh in after G20 nations pledge $5 trillion for world economy.
Africa Live. Find your voice.
The Democratic Republic of Congo has reversed a national lockdown after an outcry over price hikes. President Felix Tshisekedi announced measures to halt the spread of the coronavirus. They include intervals of lockdown, giving citizens 2 days in between to acquire supplies. This was set to go on for 3 weeks. However, as residents flocked to supermarkets, they were met with prices 2 or 3 times the normal for basic food items and essential goods. Shoppers say they will follow all measures, but they might not survive the price hikes. DRC has also put in place a state of emergency, ordered the closure of schools and universities, as well as bars, restaurants, and entertainment joints at night. All other measures will remain in place.
It is very hard and everyone is making a personal effort, but it should be the government which in this very difficult time should establish the measures so that the food doesn't get that expensive. This is all that I could buy and it's going to cost between $100 to $200 and not everyone has the means to do that.
I came to get supplies because we were told we couldn't leave our homes for 4 days, but I could only buy bread, and even that is not enough for 4 days. I don't have money to buy many things.
The decision was good because it is to protect the population, but on a social level, it was not well prepared. It was premature because they need to first get the basics right in order to protect the population.
And in South Africa, police clashed with residents of the city of Hillbrow in Johannesburg as the country began its 21-day nationwide lockdown. Hillbrow is one of the most densely populated towns in Johannesburg, with an estimated population of over 1 million people. Authorities are said to have used tear gas to disperse large gatherings on the streets. The lockdown is in a bid to help stem the spread of the coronavirus in the country. The regulations, which came into effect at midnight Thursday, have seen a number of businesses closed down. But some shops, including groceries, supermarkets, pharmacies, and banks, have been allowed to operate.
They're supposed to close down. If they're open, we're supposed to come and buy. This is that. Yes. But if this cop do beat me down, I'll fight back. You understand what I'm saying?
A sickness that's turned into like a criminal offense type of thing, because people are going to banks to go do their thing.
And there's no any sort of remedy right now to help the situation. Hence, it's everyone's, a problem that everyone is facing. So right now, it's like we're just being sanctioned.
Been lots of running battles here in Hillbrow as the police step in to try and get people to disperse, despite the fact that these are businesses that can stay open and sell food to their local customers. So running battles, lots of pepper spray. Fortunately, no major injuries just yet. I'm Angelo Coppola for CGTN in Hillbrow, South Africa.
The virtual G20 Leaders Summit was convened to discuss the challenges posed by the COVID-19 pandemic At the meeting, all the G20 leaders, including China, agreed to take work together to contain the pandemic and protect members of the public. Kenyan economist Edward Kusewa says the pledges made to share information and resources will prove vital in the fight against the virus.
There's been a call for, in the G20 virtual summit, has been a call for an emergency health ministers meeting where they could be able to start sharing information and take collective control against this epidemic. And we've been able to see philanthropists like Jack Ma just pledging some of the tools necessary to help Africa combat COVID-19. And this is just an extension to show you the principle of sharing and collaboration that China has had in the past, and the principle of multilateralism that China has purposed to help the globe. And therefore, China has committed to assist not just Africa, but globally for inclusive sustenance, and especially towards this outbreak. I think it's through China has brought up a new concept of collective collaboration amongst different international organizations and states. The principle of being able to come and share information to try and fight this epidemic together and to try and stem up policy, whether it's policy to do with public health or whether it's international macroeconomic policies that help countries to be able to sustain and fight this war together. I think we must be able to replicate that effort. Right now, the outlook has changed. I mean, structurally, there must be new adjustments, not just countries fighting things alone, but for global action. What we are seeing right now is a shift from what we call legacy assistance or traditional kind of assistance, which has been aid assistance or development finance. And now there's more concerted efforts towards public health spend, especially expenditure spend on public health, which was something that we have not seen in the past. And therefore, we anticipate that moving forward, that countries are going to set up their game towards fighting this kind of epidemics by putting more budget on public health. And this has been called for a very long time. And so for debt-ridden countries, they have to again start to structurally adjust their economies and how they look at their deficits. I think if they can shift from budget deficits to more systemized planning of how they spend their money, then maybe we could have more spend on health outcomes.
Chinese President Xi Jinping's speech during the virtual summit of the G20 leaders continues to draw reactions across Africa. In South Africa, Professor Amanda Gauls has welcomed the strengthening of international cooperation and formation of a joint force that can defeat the virus.
We live in an unprecedented time and an unprecedented situation at the moment. This is a pandemic than no other one we've seen before, and it's spreading very fast and it's quite deadly. So I think that international cooperation and specifically transnational cooperation is very important to actually do something to curb the spread of the virus. We can learn lessons from China, by sharing knowledge, equipment, medicine, and so on. So it is very important that we, at this moment in the history, show that we are a global community that care for each other.
Travelers in many African cities from Nairobi to Johannesburg are now heading to the countryside. There are growing concerns that there is a higher chance of contracting the coronavirus while in the cities because of their populous nature. There is also the counter effect of a price hike as a result of panic buying. South Africa is currently experiencing a lockdown that began on Thursday at midnight. In Kenya, a 7 p.m. to 5 a.m. curfew began on Friday. In efforts to control imported cases as well as local transmissions, governments have restricted international flights as well as the number of passengers in public buses and minivans. Amidst all these measures, travelers are now seeking solace in the countryside.
I am going back home because of the coronavirus, and the people here are many compared to the countryside. There, you just stay in your compound, where your movements are very limited.
The landlords are hard on us, saying that the government directive was nowhere in their plans.
Judging by the state of the coronavirus at home where I'm going, there's only a smaller number of people who are infected, unlike here at Johannesburg. So yeah, I think there's 80% chances that I can be safe when I'm home.
And time now for a short break, but when we return. Love and marriage in the time of COVID-19. How life has changed for Africans.
The greatest journeys, the greatest sights, the greatest adventures.
Here in Kanata, this weir allows the locals to walk on water.
We're far more than just TV news. We're your passport to the wonders of Africa.
To bring you stories of struggle, survival and hope.
So let's explore. CGTN. See the difference.
Welcome back. Nigeria has banned social gatherings due to rising cases of the coronavirus in the country, and scheduled wedding ceremonies are among the events most affected by these restrictions. A couple living in the nation's capital, Abuja, who were planning to tie the knot are now in a fix. CGTN's Kelechi Emekalam reports on how the COVID-19 shutdown is affecting their plans.
Weddings in Nigeria are usually extraordinary moments of celebrations and reunions. And for 5 years, Loveth and Joseph have dreamt about taking their wedding vows in front of their family, friends and well-wishers. The traditional wedding ceremony had been scheduled for March the 28th, and all plans were going on well. But now their hopes and plans hang in the balance, following the government's restriction on social gatherings due to the COVID-19 pandemic.
Have been on deck. In fact, as I speak, what needs to go to the village had gone to the village. We had bought everything, virtually everything needed. We are set. We are just waiting for the date. So everything about the traditional marriage is set. Like with the trend, we have to respect the laws of the land. It has affected us completely. As I see it, I'm confused. I don't even know where to go. I don't even know if we should suspend the date, if we should cancel the wedding.
I'm not really happy about the situation on ground. I've invited a lot of friends, and now it's have to. The way I'm looking at it now is going to be the situation. Might have affected some of my friends. They won't be able to come for the wedding due to the fact that the virus can easily be contacted, and there is a restriction of a particular amount of people that have to be in a gathering. So I felt the COVID-19 has actually created a very bad situation towards the wedding.
The growing number of confirmed cases in Nigeria has forced authorities to put stringent restrictions in place to contain the spread. The measures include a limit on social gatherings to not more than 50 persons, international travel restrictions, schools shut down in major cities across the nation, and a border closure. With guests invited from different parts of the country, the couple said they cannot control the number that show up for the ceremony. So rescheduling the wedding ceremony is certain.
Inconveniences cannot be quantified in terms of money. What we intend to do, or what I think should be the best solution, is to postpone it. Whether we do this traditional marriage this week or not, we'll still marry her. That our government sits to do something about it. And any medical personnel who thinks he knows one or two things to get to the root of this. I just hope God touches them, give them wisdom, and they see that we bring out this nation out of this virus.
Despite the increasing number of cases in Nigeria, Loveth and Joseph remain optimistic. They hope to overcome these trying times and look forward to spending the rest of their lives together. Kelechi Amekalam, CGTN Abuja, Nigeria.
And back in South Africa, humanitarian relief organization Gift of the Givers is joining the fight against the coronavirus. The number of COVID-19 cases in the country has shot up significantly in the past week. Gift of the Givers is setting up pop-up test stations all over the country to help ease the burden on public hospitals. CGTN's Julie Shire reports.
It's going to take a great humanitarian response to ensure that COVID-19 does not spiral out of control in South Africa. Relief organization Gift of the Givers is setting up testing stations to help ease the burden on the country's already stretched health sector.
The testing has become ridiculously expensive. We want to reduce the cost, and any person that is meeting the criteria for COVID-19 that is symptomatic, we would like them to come in, regardless of them being in isolation, to come in and get tested. Knowing your status is important because after the 21-day lockdown, people are going to be going back to work.
South Africa goes into a 21-day lockdown from Friday. The number of cases have been rising steadily and is now in the hundreds. Doctors are trying to prevent a rise in local transmissions in South Africa's poorer areas.
You have people living in shacks, 6 to 8 people living under the same roof in close proximity. Social distancing is next to impossible, and we need to protect those people. And the best way to do it is firstly keep the disease out of the townships. Number 2, identify those that have it and create quarantine sites for them. And 3, give people protective equipment like masks and hand sanitizers so that they can protect themselves.
Medical staff are bracing for the worst, but hope the lockdown will help stem the tide of new infections.
During this period of lockdown, we want to work very closely with government to identify who has it and who doesn't. Once these individuals understand or know their status, quarantine sites can be identified and they're kept there until they are better. We as the frontline soldiers, the doctors, the nurses, without shame, we can tell you that we are scared.
This is a temporary setup we've made use of. As Gift of the Givers, we are looking at other setups to actually do this. Other sites have been also identified, and we're hoping to take this project nationally.
This is a new reality for South Africa, and even the media is not immune. Testing stations are still quiet for now, but they're expecting to get busier as numbers continue to rise. Julie Shire, CGTN, Johannesburg, South Africa.
And we're not done just yet. We've got your sports news coming up. Here's a look at the headlines. We look at how athletes are maintaining their strict training regimens under lockdown.
How would you create